and welcome to Health's The Beat Executive Video Series. I'm Dr. Leana Wen, and I'm delighted to be joined today by Dr. Angel Mena, who is the Chief Medical Officer of symplr. Welcome.
Thank you very much for having us today.
Well, you've been passionate about addressing physician burnout.
Yes.
So, what are the factors in your experience that lead to physician burnout, and what are some ways for us to address that through technology and education?
Yeah, that's a great question. Let's dissect the question, right? So first is what are the factors that are really affecting burnout? I think in most cases is similar to what we see at the healthcare system or the hospital system. I mean, if we break it out to there's financial pressures, right? So that trickles down to the physicians, to the nurses. Volume is important. But now we're also pressured to drive quality, right? Quality and outcomes. The challenge with that is that we're seeing an aging population with more complex medical diseases that require more attention. So it's very important for us to drive quality care that shows outcome. And I think the third piece of the factors or the risks is the workforce. So obviously we've seen since COVID the attrition in our workforce. So not having the right team around the patient really reflects back to the physicians and the nurses, and it's harder to drive that outcome for our patients.
So,
And
yeah,
I think
sorry.
the
And then there's
second
more.
question,
Yes.
right? So how does technology can impact burnout? First and foremost, I think we need to identify what are the real problems. And as I said, there are some risks, but what are the real problems so that we align with our IT leaders? For example, in our company at symplr, we want to make sure it's not all about Gen AI or any type of AI that can help. It's about aligning with the IT, with the clinicals, with the operations, so we can truly drive outcomes and solve the problems. So I think that's essential. Start by understanding what is the problem and then implementing the technology behind it.
Yeah, I appreciate how you frame that because I think you don't want to be backwards, right? You don't want to say, here are the tech solutions, and then let's find the problems, but you want to
Yeah,
identify the problems first.
absolutely. And then we need to understand that clinicians, they need to raise their hands. They want to participate. They're the subject matter experts, our physicians, our nurses, other clinicians in the healthcare system. They want to be part of this revolution, okay, of AI or not AI. It could be any type of technology as long as it's solving the problems for them and then driving outcomes for our patients.
Yeah, and you mentioned about the inefficiencies that then also add to burnout. And so, what are the kinds of administrative tasks that can be streamlined so that providers can
Yeah,
spend their time focusing on
I
patient
I
care?
love this question. So a few years ago, we wrote an article. I'm a program director for an internal medicine residency program. As I trained in my hospital, I learned a lot from my nurses, from my senior level nurses that were there to support me. With the attrition in healthcare, we saw a lot of those senior nurses leave, right? So some of the younger nurses step up, and they still had a lot of, they need time and experiences to learn. So they didn't have time to give us back to the physicians and help us learn. So when we remove administrative tasks that keep the new nurse leaders at the desk and remove those and put them back at the bedside to help teach the newer nurses, the physicians coming up in training, it's gonna impact patient care and drive outcomes.
It's a fair point, and I don't think that there's any health professional who enters their field saying, I want to spend time doing
No,
paperwork as opposed to patient
no.
care.
I remember throughout my journey in leadership, I one of my roles a few years ago was to schedule all my physicians and my providers. It took me hours to get them into the right schedule, to understand what they needed in their schedules. With simplifying schedules and driving a platform that truly helps you, it cuts the time that I spend behind the computer and gives me time to put back to my patients or maybe my family. Just go back to what I need as a person and as a professional.
Hmm. Well, I understand that symplr recently made a big announcement.
Yes.
And so, can you tell me more about that and also how that new operations platform can better unify and improve operational efficiency?
We're very excited at symplr. I think as a physician, we always strive for evidence-based medicine, right? The analogy or the similar side of that in our business, simpler, is data-driven analytics and data-driven strategies. Okay, so what we learned from surveying CIOs, clinical operational leaders across the nation, is that there's a disconnect between the physicians and the clinicians and the technology side in healthcare. We need to align them. And what a better way to expressing all the value, all the outcomes that we can drive with a platform in the operation space that's going to help with burnout for physicians, for nurses, is going to drive outcomes, but also in the technology side, if you think about it, it's about cybersecurity, right? It's about partnering with one vendor that's going to help you drive those outcomes that you're looking for.
Mhm. Um, so speaking of that, it seems like clinicians they need to be part of the process, but
Yeah.
they also may need additional training. So what additional training do they need to keep up with this very quickly evolving healthcare technology landscape?
Well, I'll go back to my experience. So my university was my journey in healthcare. So obviously I was in the right space at the right time, but I was able to learn by connecting with the leaders and the technology team in my own healthcare system. So what I tell the clinicians is raise your hands, get involved. They need your help, and we need everyone's help. We need to collaborate as a team to really implement the solutions, the platforms that we need in our healthcare systems.
So, how do you assure clinicians who may have some trepidation? I don't know if you've
Mm,
have residents or
oof,
other or
yeah,
nurses or other clinicians who
yeah,
may just may have some misunderstandings about AI
yeah.
or worried about their jobs or something else. How do you reassure
I
them?
love it. So it's the use cases, right? So I just a few weeks ago, I met with a good friend of mine. We went to medical school together. He's a psychiatrist, practicing psychiatrist, and I showed him Gen AI, some of use cases, and he was blown away what he could do with it, right? He went back to his practice, he implemented those, and now on a day-to-day basis for his operations or clinical care, he's driving improvement. He's driving efficiencies. So get them involved in the use case. They'll see it, they'll understand it, and then they'll adopt it.
Yeah, I really like that. I think that there is people may be associating AI with ChatGPT and they don't understand the use in healthcare, which
Yeah.
could be
We've
for reducing inefficiencies or just improving care.
Of course, in our platform, we've used AI um, for years now. All right. So everyone's obviously Gen AI has created this revolution. It's at the hands of everyone, right? But it's not all about Gen AI. It's also how we use the databases, the data that we have behind us. How do we connect them to really create that platform and drive those outcomes in operations, for example?
Mm. Have you noticed a generational difference at all? Are some of the younger
Ooh,
clinicians that you're
y-
training, are they more excited
you're
or
putting me on the spot here. There is definitely a generation difference. We're seeing a new generation of physicians that have different values. The patient is at the center, but they have different values, and they will be leveraging technology to drive patient care and drive outcomes. The reality is that what we're trying to train is a physician enabled in AI.
That makes sense. Well, you have a particularly unique role, I think, as a practicing physician, as a clinician educator. You're also on the leadership team of a health tech company. So, what advice do you have for clinicians who may want to be, we may want to have the type of career that you do in health technology, and also for technologists who want to better incorporate the perspective of the practicing clinician too?
Collaboration is the key. For clinicians, raise your hands. You know, they really need the subject matter experts to be involved in technology decisions. And for our technology teams, reach out. There's a lot more of us that really want to be involved.
I really like that. And I think that that type of collaboration is what
Mhm.
leads to the unique solutions that you all have proposed as well, that specifically address the needs of the clinicians and the patients.
Absolutely,
Mhm.
absolutely.
Anything else about your work that you want to share with us, just as closing thoughts about maybe your hopes or your anything that you're particularly looking forward to?
In our vision in at Simpler in our vision of really making healthcare right, we want to make sure that we facilitate the operations of healthcare in hospitals. How do we do that? We need to understand the challenges and the problems, and then adopt the right technology, but partner with the right customers, the right partners, the right hospital healthcare systems, the right physicians, the right nurses to drive better patient outcomes. I see a bright future, okay, in the next 5, 10 years, as we see more of that technology being adopted. I really feel we will change healthcare outcomes.
That's a great note for us to end on. Thank you so much again for speaking and for the work that you do.
I appreciate it. Thank you very much for having us.